My name is Leonardo Battipaglia. I'm from New York City. I'm 60 years old. I'm here in India with my wife Elizabeth and want to share my story of how I ended up here and how I ultimately had 2 hip surgeries done here. Going back several years, say 4 years, I started to develop pain in my left knee. I was doing quite a bit of running at the time, so I assumed that it was a running-related injury and sought medical help in New York City to try to deal with this problem. Initially, I was told that yes, I had runner's knee and that I needed to get orthotics and this was going to solve the problem 100%. I went through that whole process and got orthotics and didn't really get any relief. And the pain in my knee over the months continued to get worse to the point where I had trouble sleeping at night and that kind of thing. I sought additional medical opinion in New York and again said I have a problem with my knee because that is the only place that pain was manifesting itself. And saw an orthopedic surgeon there and they really, in the end, weren't very helpful. In fact, not helpful at all. So I just, over time, ran less and less till I completely stopped and just began to develop a lifestyle so that I could still function and deal with the pain and all that. And it just became a gradual progression over months and it was difficult to deal with. Finally, I saw a doctor who immediately said, you have a bad arthritis in your, not only one hip, but both hips. And this was ultimately confirmed by X-ray. At that time, I had started to get pain in my left hip, although I had no pain at all still in my right hip, which I guess everybody's different, so you can never tell how it's going to present itself, I guess. I had health insurance at the time, but because this had been going on a long time, the insurance industry chose not to cover any medical procedures concerning my hips because they claimed it was a pre-existing condition. At that point, I decided I had to do something because I had progressed from limping to walking with a cane to limiting my walking and only walking with a cane, and that was sort of what was going on in the background. I started to research on the internet what the possibilities were and decided that India was going to be the best place for me to have hip surgery done because they have a long tradition of doing it here, and I think they have the best doctors in the world to do it. And I also decided that I would do my research directly with the hospitals rather than using a medical tourism agency. I think this is a totally personal decision, and mine was just to deal directly with the hospitals. Many people have had complete success dealing with medical tourism agencies as well, but I didn't want to have anyone filtering information, and I'm sure they charged fees also, which I just thought were unnecessary. I contacted numerous hospitals in India, I'd say 10 different hospitals at least, and they really tended to respond in a lot of different ways, and in general, they would have a doctor whose job just seemed to be to correspond with people that were inquiring about services at the hospital. In only one case did I actually get to correspond with the surgeon who was actually the person who would do the surgery on me, and that was Dr. Venkatachalam. He is in the south of India, in Chennai Health City. His website, by the way, is www.hipsurgery.in. And I've seen the website grow over time, and now it is extremely informative. There's a lot of information there, and I recommend everyone have a look at it. This was really a critical point to me, that I could not only correspond with Dr. Venkatachalam, but that his communication was extremely responsive in the sense that he wrote back immediately. He would discuss anything, any issue I chose to bring up. He was willing to go there. And when you're in a position like I was in an extremely degenerative state, knowing I had to do something, there is a certain, you want to be very careful about how you proceed so that this becomes a once-in-a-lifetime event and you can get on with your life. So I felt extremely comfortable with Dr. Venkatachalam. That was one because of that. The other major issue was I sent copies of x-rays to numerous places, including Dr. Venkatachalam, and the response to these x-rays was exceedingly different as well. As it turns out, I didn't have the most straightforward problem with my hips, that there was certain complications involved, and that eliminated, I'd say, 90% of the people that I was dealing with just said, we aren't interested in any complications. We'll only do it if it's perfectly straightforward, or they just made a price quote that was so exorbitant that they effectively told me that they didn't want to do it. And this was the exact opposite with Dr. Venkatachalam. He wanted to discuss all the little peculiarities of my situation, tell me what they meant, tell me possibilities of how we deal with them, and assure me that in the end I could have normal hip surgery and nothing totally out of the realm of possibility existed. So after that, we decided to come to India and have the hip surgery done. My first visit to India was in November of 2008. As it turns out, we were actually in the air flying into India when the attacks occurred in Mumbai. Terrible thing, but since we were going to the southern part of India, where they don't have a lot of problems of that nature, we were totally unaffected by that. After coming to the hospital, further investigations were done to confirm what we had discussed, and it was determined that the first hip that would have the operation would be the right hip. That was the hip that was in better condition, actually, and because of that, it was possible to do what they call hip resurfacing on that hip. This was developed in Birmingham, England, I believe, and Dr. Venkatachalam studied with the creators of this method to develop his expertise in this particular type of prosthesis. Basically, everything went fine with the surgery. The hip resurfacing was possible. It was done. There was no complications of any kind. I felt very good with my hip right after the surgery, and that's sort of the big picture of the situation. Of course, you're in a hospital and you have to be cared for, and I'd like to just mention a few things about that. First of all, the nursing staff is just outstanding at this hospital. They're completely versed in everything they need to know about how to take care of people. They're very compassionate. They are efficient, and it was a big part in helping speed my recovery and feel comfortable while I was here. Also, the facilities of the operating theater were state-of-the-art. That goes without saying, and everybody involved in that process, the anesthesiologists, et cetera, was very considerate. I got to talk to them ahead of time, discuss what was the best approach for me. There's different approaches you can take as far as the anesthesiology goes, and they discussed that individually with every person and